Hi everyone, welcome back to my channel. I'm Stella, and today we're diving into a topic that's been gaining a lot of attention lately: ketamine. From its intriguing history to its potential as a healing tool, we've got a lot to cover. So grab a cup of tea, sit back, and let's explore the enigmatic world of ketamine. Let's start by shining a light on the history of ketamine. Did you know that it was first synthesized in 1962? 62 years ago, this remarkable molecule was synthesized by Professor Calvin Lee Stevens, PhD, an organic chemistry professor at Wayne State University at the time. Professor Stevens' pioneering research on ketamine paved the way for its application in both veterinary and human medicine. His breakthrough findings transformed the realm of anesthesia, offering healthcare providers a reliable and safe substitute to conventional methods. This molecule, ketamine, CI581, a derivative of phencyclidine, was swiftly evaluated in a clinical trial as early as 1964 and promptly incorporated into clinical practice. Since then, the medical and scientific communities have been sharply divided between strong believers and passionate doubters. Numerous studies have explored how ketamine works, highlighting its widespread and safe use in anesthesia across different settings, from pre-hospital to hospital environments, and through various administration routes. Its remarkable lack of respiratory depression often negates the need for intubation and respiratory support, making ketamine a preferred choice for anesthesia, especially in challenging situations such as battlefield scenarios. Opponents of ketamine highlight its potential harm to the brain and its tendency to induce psychosis-like experiences, often observed in schizophrenia research. However, there's no evidence supporting long-term brain issues after a single use, regardless of age. Ketamine is now utilized for anesthesia and sedation in brain injury patients, dispelling previous concerns, and despite its recreational use since the late 60s, its negative reputation persists. Ketamine's journey extends beyond its initial discovery in the 1960s, so let's delve deeper into the historical journey of ketamine and its fascinating role in wartime medicine. During the Vietnam War, ketamine emerged as a crucial tool in battlefield medicine. Its unique properties, including rapid onset and minimal respiratory depression, made it ideal for use in combat situations where traditional anesthetics were impractical. Military medics relied on ketamine to quickly and safely anesthetize wounded soldiers, allowing for swift medical intervention on the battlefield. Its versatility and efficacy in trauma situations earned it the nickname buddy drug among troops. In combat situations, ketamine emerged as a crucial tool for providing immediate pain relief to injured soldiers without the concern of respiratory complications. Unlike opioids like morphine, which were traditionally used for pain management, ketamine offered effective relief without the risk of respiratory depression. This was particularly important in severe injury cases, where high doses of opioids could lead to respiratory issues, posing a threat to the soldier's life. Ketamine's impact on military medicine didn't end with the Vietnam War. Its continued use in conflicts around the world highlights its enduring importance in emergency and trauma care. As ketamine found its place on the battlefield, another discovery was unfolding at a rapid pace: its potential as an accelerator for psychotherapy. The first evidence of this breakthrough emerged from the work of psychiatrist Salvador Roquet, based in Mexico City. In 1973, Dr. Roquet published a groundbreaking study showcasing ketamine's role in enhancing psychotherapeutic processes. This study marked a significant milestone in the exploration of ketamine's therapeutic applications beyond anesthesia, shedding light on its profound effects on the mind and its potential for revolutionizing psychiatric treatment modalities. Despite early studies showing the potential of ketamine paired with psychotherapy for treating mental health disorders, progress in researching this modality was slow for many years. The climate of the early 1970s, marked by President Nixon's declaration of the war on drugs, made it challenging to conduct research on psychoactive compounds like ketamine. Consequently, scientific efforts in mental health treatment during the 70s through the early 2000s primarily focused on developing medications that targeted serotonin, norepinephrine, and dopamine levels in the brain. But in the early 2000s, the tides began to turn, and here's where it gets really interesting. research on ketamine gained momentum once again. By 2006, the National Institute of Mental Health made a groundbreaking announcement. Their studies were showing that a single intravenous dose of ketamine had rapid antidepressant effects. Talk about a game changer. Most early ketamine clinics were opened in the early 2000s by anesthesiologists who were comfortable using ketamine in the operating room, offering IV ketamine infusions or intramuscular injections for various psychiatric conditions, such as depression and post-traumatic stress disorder, PTSD. Looking beyond its controversial reputation, ketamine emerges as a beacon of hope in medicine and therapy, particularly notable for its application in treating depression, alongside its well-established role in anesthesia. This dual capability highlights the intersection of medical science with mental health therapy, reshaping approaches to treatment. Since its synthesis in the 1960s, ketamine has been the subject of thousands of scientific studies. These studies encompass everything from its pharmacology and mechanisms to its use in various medical and psychiatric conditions. Many studies have shown that ketamine can have rapid and profound antidepressant effects, often relieving symptoms within hours rather than weeks, as is common with traditional antidepressants. Speaking of studies, let's take a closer look at two pioneering pieces of research that highlight ketamine's potential. In 2013, a groundbreaking study rocked the field of psychiatry, offering new hope to those battling severe depression. The study was published in the American Journal of Psychiatry, where researchers conducted a randomized controlled trial comparing ketamine to a placebo in patients with treatment-resistant depression. The results were astonishing. A significant reduction in depressive symptoms was observed in the ketamine group within hours of treatment. Another study, this time published in JAMA Psychiatry, analyzed a nationwide register in Sweden and found that ketamine treatment was associated with a lower risk of hospitalization for depression compared to standard antidepressants. So what does the future hold for ketamine? Well, the possibilities are vast. Researchers are continuing to explore its potential applications, from pain management to addiction treatment. Fresh off the press, a randomized clinical trial published in April 2024 explored the effectiveness of a single low dose of esketamine in alleviating symptoms of postpartum depression in women. Esketamine, a derivative of ketamine, has garnered attention for its rapid antidepressant effects. The study compared the effects of a single infusion of esketamine to a placebo in women experiencing postpartum depression symptoms. The results were nothing short of remarkable. Women who received esketamine reported significant improvements in their depression symptoms within just a few hours of treatment. This offers a glimmer of hope for those struggling with the debilitating effects of postpartum depression. As we approach the culmination of our journey, the horizon teems with the untapped potential of ketamine. As our comprehension of its effects deepens, its significance in medicine will broaden. With continuous research and technological progress, we stand on the verge of embracing ketamine's full capabilities, potentially making it a mainstream treatment for diverse conditions. Ongoing research into its anti-inflammatory and neuroplastic effects could broaden therapeutic horizons, offering new methods in pain management and neurological health. With each study, the boundaries of knowledge are expanded, promising revolutionary advancements in treatment methodologies. This section not only demonstrates how the story of ketamine is constantly changing, but also encourages further exploration, poised on the brink of new discoveries that have the potential to revolutionize therapeutic methods and improve human health. As we close this chapter, let's think of it as the beginning of exploring ketamine further and opening doors to future possibilities. Isn't it truly fascinating how this one molecule has been used in different ways for many years and continues to discover new purposes? Ketamine is undoubtedly one of the most significant substances in medical history. And there you have it, a glimpse into the enigmatic world of ketamine. If you found this video enlightening, why not show your support with a thumbs up and subscribe? Stay tuned for more engaging content that delves into the infinite possibilities that lie ahead. As always, thank you for watching, and I'll see you in the next video. Stay curious.